If you are over 60, there is something very important you need to hear right now. Because your body may be trying to warn you about something serious, and most people never notice it until it is too late. Cancer is one of the most silent health threats facing older adults, and it rarely begins with dramatic or obvious signs. Instead, it often whispers through small, subtle changes in your body, changes that many seniors dismiss as just a normal part of aging. But ignoring these quiet signals can be the biggest mistake of your life, because catching cancer early can mean the difference between life and death. That's why today, we are going to uncover 6 silent symptoms of cancer that seniors must take seriously. These symptoms are easy to overlook, but once you know what to watch for, you'll never see your health in the same way again. And if you care about living a long, strong, and healthy life, make sure you stay with me till the very end of this video because your future might depend on it. And right after I reveal these critical signs, I'll also share a powerful piece of advice that could help you protect yourself and your loved ones. So let's begin. And if you haven't already, make sure to subscribe right now so you never miss life-saving health tips like these. Begins with one of the most common but often ignored early signs: unexplained fatigue. Now, everyone feels tired from time to time, especially as we age, but this kind of fatigue is different. It's not the kind of tiredness you can shake off with a nap or a good night's sleep. This is a deep, persistent exhaustion that lingers for days or weeks and doesn't match your usual activity level. Seniors over 60 often brush it aside, thinking it's just part of getting older, but in reality, it can be an early warning sign that cancer cells are growing in the body, draining energy and nutrients, and disrupting the immune system. Fatigue linked to cancer can show up even if you haven't done much physical activity, and it can be accompanied by weakness, dizziness, or a lack of motivation that feels unusual for you. The danger lies in dismissing it. If you feel this type of fatigue more often than not, it's not something to ignore. It's your body's way of asking you to pay attention and seek medical advice. Because in many cases, this kind of silent symptom shows up long before cancer is diagnosed, and catching it early can change everything. Brings us to another silent but crucial symptom: unexplained weight loss. Many seniors think of losing a few pounds as a positive thing, especially if they have been trying to manage their weight. But weight loss without trying, without changes in diet, exercise, or lifestyle, can be a red flag that something more serious is happening inside the body. Cancer often affects metabolism, meaning it changes the way the body uses energy and processes food. Tumors demand nutrients to grow, and in the process, the body begins breaking down muscle and fat at an alarming rate. Seniors over 60 should never ignore rapid weight loss, even if it seems like a welcome change at first. If you find yourself losing more than 5 to 10 pounds within a short period without explanation, this is not something to celebrate. It's something to investigate. Because while weight loss can be linked to many conditions, it is one of the most silent and consistent early signs of cancer, particularly cancers of the stomach, pancreas, lungs, or esophagus. The key is not to panic, but to pay attention. Ask yourself, have you made any lifestyle changes that explain the weight drop? If the answer is no, then this is exactly the kind of signal you cannot afford to dismiss. Focuses on a symptom that many seniors dismiss as minor or unrelated: persistent pain. Now, occasional aches and pains are common with age, but pain that lingers or keeps coming back in the same area can be an early signal of cancer. This pain doesn't always have to be severe, but its persistence is what makes it alarming. For example, constant back pain could be connected to spinal cancer or even pancreatic cancer, while a dull ache in the abdomen might be related to ovarian or stomach cancer. Seniors often think, oh, it's just arthritis, or it's just age catching up, but ignoring new or ongoing pain can allow cancer to spread silently. What makes this symptom so dangerous is that it often blends into the background of normal age-related discomfort, tricking you into thinking it's harmless. But if pain is new, unusual, or refuses to go away after weeks, it's worth discussing with a doctor. The key difference is that age-related pain usually has a clear cause, like arthritis or an injury, while cancer-related pain often feels different. It might be sharper, more constant, or appear without reason. Remember, persistent, unexplained. Pain is never just something to live with. It can be one of the body's earliest cries for help, reveals another quiet but serious symptom, changes in your bathroom habits. Seniors often notice differences in bowel movements or urination as they age, and many chalk it up to diet, medication, or just getting older. But sudden, unexplained, changes in how often you use the bathroom, the color of your urine or stool, or even discomfort when going can be early indicators of cancers in the bladder, kidneys, colon, or prostate. For instance, blood in the urine or stool, even if it appears only once, should never be ignored. Likewise, constipation, diarrhea, or the constant feeling of needing to go but not being able to can signal something serious. These symptoms often develop slowly and subtly, making them easy to dismiss, but they are among the most important silent signs seniors over 60 must pay attention to. While not every change means cancer, the danger is in assuming it's nothing. Seniors who act early when these symptoms appear are far more likely to catch cancer before it advances. The body rarely lies. It leaves clues, but it's up to us to listen. Ignoring these silent bathroom changes may seem harmless in the moment, but they can be the key to early detection and life-saving treatment. Highlights unexplained weight loss, something many seniors may even welcome at first, especially if they've struggled with weight for years. But here's the hidden danger. When the body suddenly begins to shed pounds without any changes in diet or exercise, it can be one of the earliest red flags for cancer. Cancers such as stomach, pancreas, esophagus, or lung cancer often interfere with the body's ability to absorb nutrients, burn calories, or maintain muscle mass. At first, losing a few pounds may feel like a positive thing, but when that loss continues rapidly and without effort, it's the body signaling that something is seriously wrong. Seniors sometimes dismiss this, thinking their appetite has simply changed with age or that it's normal to get thinner, but that's not true. Healthy weight loss requires effort. Unplanned weight loss is often the body's cry for help. Doctors consider a loss of more than 10 pounds in a short span, without trying, as a warning sign that needs medical attention immediately. The risk is that by the time this sign is ignored, the cancer has already advanced, making it much harder to treat. So if you or a loved one over 60 notices sudden, unexplained weight loss, it's not something to celebrate, it's something to check right away. Focuses on fatigue, but not just ordinary tiredness from a busy day or poor sleep. This is deep, unrelenting exhaustion that doesn't go away even after rest. Cancer-related fatigue is different. It drains your energy in a way that feels unusual and disproportionate to your daily activities. For seniors, it may feel like walking across the room suddenly takes the energy of climbing a mountain, or simple tasks like cooking or bathing feel overwhelmingly difficult. This kind of fatigue often comes from the cancer consuming the body's energy supply or from the immune system constantly working to fight the disease. It is one of the most common yet overlooked early symptoms of cancer because most seniors naturally expect to feel more tired with age. But here's the truth. Normal aging fatigue improves with rest and healthy routines, while cancer-related fatigue lingers no matter what you do. Ignoring this silent symptom can delay diagnosis, giving cancer the chance to grow unchecked. Paying attention to energy levels, especially when fatigue feels new, severe, or unexplainable, can make the difference between catching cancer early or missing the window for effective treatment. Is about unusual bleeding or bruising, a symptom that can easily be dismissed as minor, but is often one of the strongest warnings the body can give. For seniors, noticing blood where it shouldn't be, such as coughing up blood, blood in the urine, stool, or unexpected vaginal bleeding after menopause, is never normal. Similarly, frequent or unexplained bruises on the skin that appear without injury can indicate blood-related cancers like leukemia or other serious conditions. These small but significant changes in the body are signals that something deeper is happening, and when ignored, they allow cancer to spread silently. Many seniors make the mistake of attributing these signs to aging, fragile skin, or minor issues, but in reality, these could be the earliest and most important warnings that cancer is present. Paying attention to unusual bleeding or bruising can lead to early detection and often life-saving treatment, which is why this symptom must never be ignored. So to all of you over 60 watching right now, remember, your body is always trying to communicate with you. These 6 silent symptoms of cancer, persistent pain, changes in skin, digestive problems, unexplained weight loss, unrelenting fatigue, and unusual bleeding or bruising are not just random issues to brush off as aging. They are potential red flags that demand attention. The earlier cancer is detected, the higher the chance of successful treatment and survival. That's why listening to your body, scheduling regular checkups, and never ignoring these signals is so critical. If you've noticed any of these symptoms in yourself or a loved one, please take them seriously and consult a doctor without delay. And before you go, if you found this video helpful, don't forget to hit that subscribe button so you never miss future health updates that could one day save your life. Stay informed, stay healthy, and take care of yourself. You deserve it.